Hi, everybody. I'm Louix Dor Dempriey, and we're taping here live in Laguna Hills, California. It's the 11th of April, 2020, on Holy Saturday, and I'm here to give my second installment of my COVID-19 coronavirus talk. So what I'd like to do, I'm going to do a little bit of recap and reminders for people, and then get into some other new information as well, and I will strive to be as succinct as possible. So I hope you listen to the end. So a couple of things that are going on right now. There's been a lot of complaining and confusion about the dribbling out of information from the authorities and the governments and the inching forward of deadlines. And basically, that's happening for very specific reasons. Number one, the primary reason that they just keep inching deadlines and that they have dribbled out information and sometimes seemingly do 180s, 180-degree turns, it's all been to prevent panic and mass hysteria. So there are a lot of things that obviously that the medical world would know and the governments would know, but if they come in with all, big guns, people will go crazy. There's already been a colossal spike in gun purchasing. There's already been some stores in certain cities are boarding up in anticipation of looters. As I said in my last discourse, there have been fistfights in supermarkets. So even at a very, very low level, when this was just beginning, it's already being seeded. So they're just dribbling out the information to help stave off that kind of panic and hysteria, which is not the same as lying. So just understand that. They have to deal with, there are 7 billion people all being affected by this. Now, a couple of specific things. The business with masks. In the beginning, they said, don't wear them, it doesn't matter. And yes, they knew they were helpful, of course. And in my first discourse, I said so as well. Now it's becoming mandatory almost to the point of a legal violation if you don't have them on. The reason they did that was not to lie to people and endanger people. There was a gross shortage of masks, and the doctors and nurses and patients in hospitals did not have them. They didn't have anywhere near enough. And those of you who have been following the statistics, many, many, many doctors and nurses have died. And if they start dying en masse, then who takes care of the sick people? So they were trying to get the masks to the places that were really critical to take care of even larger numbers of people. Now that the Defense Act has been engaged, other countries are contributing, companies are helping, millionaires are helping, everybody's helping each other now. And the mask supply, the medical supply inventory has gone up dramatically. And now, again, they've dribbled out and said, no, you do need masks. Everyone go get them. They do help. Just in the last 3-4 days, so please don't be offended by that. It was to serve the greater good. What serves the highest good for the greatest number of people in any given moment? And could there have been collateral damage? Perhaps, but a great many lives were saved by doing that. And now hopefully many, many more. One of the things that I've seen starting to happen just in the last 2-3 days, people are now wearing the mask over their mouth with their nose out. I mean, why not just cover one nostril? It's mouth and nose. So please, any of you thinking that? Mouth and nose. So, and then also the inching of the deadline for the quarantine. Same purpose. They can't just say, boom, it's going to be July, boom, it's going to be August. The world would go insane. You would see pandemonium and atrocities I don't even want to describe. So and then there's a minor factor too. There are variables they don't know. They're scrambling at breakneck speed to come up with treatments. They're working on vaccine. They're doing blood plasma therapy. They're doing everything under the sun. But also, they already know it's going to be longer than they have said. They're just trying to stave off hysteria, panic, and riots, and God knows what else. Now, let's see. The end of the quarantine date. Obviously, I mean, first of all, another thing that a lot of people don't know, a lot of people do know this, but the numbers are exponentially higher than what's posted for a couple of reasons. Misdiagnosis is a small one, but there's only been a very, very minuscule percentage of the population that has been tested. So the statistics we see are only based on either people arriving in hospitals or people going to get tested. So the numbers are much, much higher. That's neither here nor there. In terms of, when it peaks, when it troughs, that's another one they're inching to keep down hysteria. This has not hit peak yet, and it's not even that close just yet. So you just need to understand that this is going to be many more months of this. I'm going to get more specific about that in a moment. Which is actually right now. I want to take some time to clarify this mass ignorance about the worldwide quarantine. And I'm seeing it in almost 100% of everyone I talk to, every text, other people's conversations I've overheard, things I see in the media. Put simply, the virus does not end when the quarantine ends. Almost everyone on the planet thinks they are synonymous. They almost have nothing to do with each other. The quarantine was for one purpose alone. It was to, they use a phrase, flatten the curve, but since most people seem to not know what that means, it was to slow the spread so that the medical model, the medical institutions, hospitals, doctors could sustain and be able to accommodate the hordes of people coming in who need medical care. So they created this worldwide quarantine so the numbers could be slower. It does not stop the virus. It was never intended to. The virus cannot be stopped. Also, a great percentage of the population will have this at some point, just like a great number of the population gets the flu. So one of the common things I hear people saying is, I can't get together till the quarantine ends. People are even talking sexually. I can't have sex till the quarantine ends. The only thing that changes when the quarantine ends is that we can go outside of our doors. But behaviors still have to keep going. The social distancing needs to keep happening, and all the protocols people have in place need to keep going until certain things happen. The change regarding the virus happens when three factors happen. Number one, and it's already well underway, they're very, very rapidly developing and working on treatments to mitigate, to reduce the symptoms and alleviate some of the suffering for those who do get it. So it won't kill as many people, and so people won't have as severe a condition while they have it. So they're already working on that very, very much. Number two, until an enormous amount of the global population has had it and recovered, then there will be in the collective consciousness, in the critical mass of humanity, there'll be antibodies and certain level of immunity. Not necessarily 100%, but a certain level, a strong level of immunity and antibodies all over the planet. And point three, a successful vaccine. That point three will take the longest, but I could guarantee you it's going to be quicker than the development of normal vaccines for other things that have happened, because there's the numbers of people being affected and the potential for cataclysm is so huge, they're working as fast as they can. But until some combination of those three things happen, when the quarantine ends, we are exactly where we are now. It's the same virus. It's just as contagious, just as lethal for those for whom it is. And you will see, no matter what happens, there'll be a spike in numbers when the quarantines end. And they're already planning to meter out the quarantine. Certain things will phase in. Maybe people who've had it will come out first because they'll have higher antibodies, things like that. It won't just be open the floodgates across the board. They will design a plan that will, again, slowly reintegrate everyone into society. But keep in mind, when the quarantine ends, however it ends for you and when, it's the same virus, just as contagious, just as harmful, and it's still there until the antibodies build, the immunities build, the vaccine comes. And viruses like the flu and other viruses, they go in waves. So there will be a wave that goes through, and then it will naturally die down, and then repeat, rinse and repeat, like our seasonal flus happen. So there'll be another wave that comes later, which will, just by definition, be smaller, be less, fewer numbers, and it won't be as catastrophic as this because of future vaccine, antibodies built. So keep that in mind, so this ignorance won't cause more problems when the quarantine ends. It's not business as usual. There needs to be in everyone a reformed consciousness and a responsible way of behaving as you go around. It doesn't mean hazmat suits forever either, but it's not what people think now. Just open the door and game on. Okay, so spread the word on that, please, please, please. Okay, so let's see. Oh, I actually covered that one already. So I want to do a quick recap on the protocols that I covered last time, and I might even add a few. So you have external and internal protocols. External ones, I think everybody knows by now. The main ones, social distancing, so maintain good 5-6 feet away from people. And again, it's not just coughing and sneezing. The moisture droplets carry in your breath, which travels at least 3-4 feet without coughing and sneezing. So you want to be a good 5-6 feet away from people and not talking directly into people's faces. Masks whenever possible when you're out in public. Minimize your public exposure as much as possible, and most people are really good about that now, just going to the grocery store or an errand to the bank if they have to, or just very minimal. Don't have group gatherings if you can help it. Let's see. And don't touch your face. Frequent hand washing. And another one I did not mention last time. I hope the company doesn't get upset with me, but in this particular case, I'd like to mention it. There is a very powerful alchemical holistic treatment that I would like to recommend. I've been using it and telling everyone I know to use it. It's called Thieves Oil. It was developed in the Middle Ages when bubonic plague was eradicating the planet. Many of you who have read or learned about it know how fast and how deadly it was. And this group of alchemists came together and created a concoction of oils, of essential oils. And every single person who used these oils did not get the plague. And so they named it thieves because they cheated death. I know in this country there's a really good essential oil company called Young's Essential Living Oils, or Young's Living Oils, and they sell it. And I just put a drop and rub it on the soles of each foot. And I also put it inside my mouth. No double dipping, of course, but I rub it around my gums and on my tongue. Some people put it on their ears and nape of the neck. I can't do that. It burns. It really, really burns. But it's phenomenal. So I highly recommend that, the use of that. And I'm just doing it, if nothing else, just do the soles of your feet. I recommend twice a day, in the morning, like after you shower, and before you go to bed at night. And again, that's something ongoingly. I've been using it for many years. Every time I get on an airplane, I use it because I fly an enormous amount. And for many years, I would get strep throat on planes or get a sore throat every time I got off a plane. And I haven't got sick once by using the Thieves Oil before I fly. So it's not just a coronavirus treatment. It's a very powerful health treatment. And as I said, it prevented every single person who used it from catching bubonic plague. So let's see. Now, internal. As I said before, all illness needs and thrives in an acidic environment. So one of the most powerful ways to make your body healthy and to create a fortress to prevent infection and illness of all types is to create an alkaline balance in your body. There are many things that do that. Again, that could be an hour discourse. So I'll just give you a couple of bullet points. Lemon water, and specifically, which the most powerful way of having the lemon water for alkalizing is if you cut the lemon rind up and put that in with the lemon water, and then pour hot or boiling water over it. Obviously, let it cool to a comfortable temperature. But I start my day with that on an empty stomach. And people have asked me since I announced this, they said, but lemon is citrus is an acid. Lemon does alkalize. I don't think, or I don't know that all the other citrus fruits do, but lemon does. So also kombucha. I don't know if I mentioned that last time. I think I did. Drinking kombucha, raw apple cider vinegar, something simple like an ounce a day, is plenty. And maybe substitute that as your salad dressing some or most of the time. And use it in your dressing. Kimchi is another fermented food that came out of Asia, and it has a very high level of probiotics in it, and some people have probiotic supplements as well. Also, lots of fruits and veggies, especially the dark leafy greens. Reducing sugars. Sugar is fertilizer for all illness. It's like Miracle Grow and cow manure putting on cancer. It actually accelerates growth of cancer, but it's fertilizer for all illness. So reducing your intake of sugars. And you can do some Googling yourself to see what alkalizes your body and other things to strengthen your immune system. The internal protocols are just as important as the external. So it's not so much just for coronavirus, but for keeping yourself healthy so you don't get other types of infections and illnesses. It's very, very important. And then the third protocol, which I think I've already touched on, is hunker down. Minimize exposure to large numbers. Honor the state and federal statutes that have been put in place wherever you live, whatever state and country you live in, just so we can all cooperate and flatten the curve and meter this out and get through this wave with minimal collateral damages. Okay, so moving on. Endgame. Is this pandemic achieving the purpose for which humanity summoned it? And the answer is yes. To what degree, that remains to be seen, but it is. If you recall, again, from my last discourse, I gave you the three primary causes at the causal level of why it came onto the planet. While everyone's arguing and debating over how, what's more important is why it came. And I shared in the first discourse, there were three things: greed, corruption, and a term I called disassociation. So is the pandemic achieving its purpose in those three categories? Absolutely. In terms of greed and corruption, the largest violators and offenders are the ones who are being the hardest hit, and more specifically, the ones who are being most responsible for the bailout to help everybody else. The government, the banks, and the insurance industries will be very, very hard hit by this and are having to waive fees, waive penalties, waive payments, give all kinds of discounts, and also spend money to bail out and help people to take on. So there's been a huge karmic balancing, and that will continue. And going into an even more important category, the disassociation. And I don't want to take the time to repeat what that was. Go see the other discourse if you're not clear on that. But you'll get the gist of it as I move forward. First category of the disassociation, family. People are rediscovering family, a concept that was all but gone in many parts of the world, and all over the world to a degree, and in some areas much, much worse. Think about it. It's no coincidence that the country most powerfully hit by this disease, the United States, is the country where the disintegration of the family unit is by far the most severe of this country anywhere in the world. That's the reason why it hit here the most. There are smaller reasons too, the slow start, and I won't go through the whole list. The lag, the slow start time the government had, withholding of information. There are other things that happened. But at the causal level, the breakdown of the family unit here has been appalling. And now families are rediscovering each other. People are all forced to be home, being with each other. And, parents are with their children. Siblings are together. Relatives are together. People are having meals together. So it's really, really changed people a lot. People are developing a deeper appreciation for those in their inner circles, in their soul family, in their biological family. People are really changing in a really beautiful and powerful way. There's been, number two, there's been a huge spike in caring and helping of one another. People are donating money, large and small. Companies are donating money and services. People are doing so much stuff. It's known, this is not new information, but crisis has a tendency to bring out the best in people. And we're seeing so much caring happening now and people just going out of their way to help others. And third, a very interesting thing that's happened is there's been a huge surge in faith and religion. And it's, when people become desperate, it's kind of sad that for most of the world, God is like the lender of last resort. But when people get pushed up against the wall, and push comes to shove, pretty much it's a human instinct to cry out for God. Even atheists will cry out for God because we're made by God. We're part of the tapestry of creation. So it's intrinsic in everyone, regardless of your habits and belief systems. And this global pandemic, I know that's redundant, has just helped a lot of people and inspired a lot of people to turn toward God or to deepen in their religion or to return to religion or find faith through their spirituality. And that's a beautiful thing. At times like these, when catastrophes happen and pandemics happen of any kind, people will often cry out and say, why did God do this? Why did God let this happen? If there was a God, why would she let this happen? It's really important to understand, this is another ignorance that I hope I can clarify. God did not create this. Humanity created this. It's true that God allows it, and there's a reason. It's not because God is the big meanie or like religion's the wrath of God. It's not punishment. God doesn't punish anyone. God is not angry. God is a river of love that is ever flowing. God does allow it in her omnipotence because, I'll share a proverb of mine with you, suffering is a wayward humanity's incentive to turn toward God. So suffering wears down resistance. It wears down defiance. It wears down the fight. And that's why when things like this happen, the Creator allows it because it wears people's resistance and their fight down, so it eventually inculcates and engenders surrender, which has so many beautiful, beautiful effects. So it is all happening. So the future, what needs to happen? Well, there needs to be real permanent change in these three categories I described at the causal level. If people in institutions just, open their door and go back to game on, go back to the way they were, that's not a good thing. And that's not going to happen. Some of the changes that are happening now will stick. It's only a question of to what degree. But if it's not enough, something else bigger will come along. It may not be a pandemic or a disease, but something. Maybe there'll be an amping up in the global warming that weather will take on, new catastrophic levels we've never seen. I mean, that's happening anyway, but it might even go even higher to get people's attention and to have people, again, engender surrender and become more kind, more loving, and live the way we were meant to live on this planet. Less violence, less abuse, less pollution, less mistreatment of one's own body, and start to treat it like a temple and treating other people like the divine beings we are. So be hopeful, as I am, that a certain amount of change is going to stick. And let's just hope and pray it's a lot. But what's most important, and this is the thing I'll leave you with, is to remember this axiom, this mantra. It's all up to me. What each person has to play his and her part. What doesn't help is the finger pointing, the blaming, and the worst of all, waiting for someone else to do something. Take it upon yourself. It's all up to me. Make the changes in your own life, with your diet, with your nutrition, with the way you behave, with how you share and give your love and care for others, the kindness you show. You're efforts in not polluting, your efforts in recycling, your efforts in just being a kind, loving human being. And that lessens all that the universe has to do on our behalves if people just continue in selfishness and greed and corruption and being non-loving in the ways some people do. Not everyone's like that. Some people are very kind and loving. But the numbers have to change. And the reason so much intensity is happening now is because the change has not been happening fast enough and by a large enough number of people according to the divine blueprint, according to the will of God, what's written in the Akashic records, so to speak. The blueprint of creation, for those who don't know what that phrase means. So there is a blueprint, and these things speed up the process. Remember, suffering wears down resistance, so people will say uncle and then start to change and turn more and more into the kinds of divine beings where we all truly are and are all meant to be. So take heed, have hope, and I don't know if I'll have another installment, but there's a good chance I will. But I do want to thank you for giving me your time, for lending an ear and an eye. And I implore you, please share this with others. Link it on your, post it to your wall, share it, email it to people, and talk about it. And thank you so much. Be well, take good care of yourself and others, and namaste.